everyone, welcome to another engaging session of Ditalk 2.0. Today, we explore a vital and thought-provoking topic, psychological impact of disasters and mental health support. Our speaker, Nandana, will guide us through the emotional toll of disasters, effective mental health strategies, and their broader implications for communities and resilience. Without further ado, let's welcome Nandana to the stage.
Thank you, Kalvi. So, my topic is based on what are psychological impact of disaster and understanding mental support in crisis situations. So, disasters, whether natural or man-made, it always triggers anxiety, trauma, and depression, with effects varying by age, culture, socio-economic status, and mental health conditions. So, what do you understand by mental health support? Psychological recovery is critical for rebuilding lives and communities, yet often overlooked and compared to a physical aid. Its mainly the objective is explore disaster-related psychological effects, understand effective mental health support strategies, and recommend practical and cultural sensitive solutions for the resilience. So, what are the immediate effects of disasters? There is a short-term psychological effects, which is acute stress reactions, which means fear, shock, confusion, and panic during events like the 2023 Turkey Syria earthquake, where survivors reported disorientations amid collapsing structures. Survival, intense remorse for surviving when others perish, common in events like 2004 ocean tsunami, where survivors mourn lost family members. Especially affects the children and those with cognitive impairments, leading to difficulty processing events. Now, there is a psychological short-term effect, which is flashbacks or nightmares or hypervigilance, reporting 20 to 25% of survivors post-major disasters. This also includes anxiety and depression, where there is fear of recurrence, example aftershocks or shocks, loss of safety fears, persistent sadness, hindering recovery efforts. Mourning lost loved ones, homes, or livelihoods, as seen in 2024 South Asian flood survivors. Now there comes the long-term psychological effects, which means it disrupts daily life, with symptoms persisting years later. One of the examples is there was 10% of 2004 tsunami survivors still showed PTSD in 2009 studies. Increased alcohol, drug use as coping mechanisms noted in post-Hurricane Katrina communities. On the other hand, stigma or trauma leads to withdrawal, exacerbating mental health challenges. Very most vulnerable population was children. Their regression, separation anxiety, or poor school performance were seen. Early, heightened depression due to loss of social networks or health decline, as seen in 2023 Turkey Syria earthquake survivors. There were some marginalized groups which included refugees, low-income individuals, and minorities face compounded stress due to discrimination or resource scarcity. Now there are challenges in addressing psychological impacts. There is a stigma surrounding mental health, which means there are cultural taboos, like India's view of therapy as weakness or Japan's emphasis on stoicism, which means the post-2011 tsunami happened, which deters survivors from seeking help. For example, in rural India, 2024 flood survivors often avoided counseling due to fear of community judgment. This was reported by NGO people. There were limited access to services, which means that rural and disaster-hit areas like Mozambique post-2019 cyclone, Idai, lack mental health professionals. For example, one psychiatrist per 1 lakh people in some African regions. The infrastructure damage post-disaster further restricts access to the clinics. There are some some resource constraints in disaster response, which means that disaster response prioritizes food, shelter, and medical aid with mental health often underfunded. For example, there are only 5% of aid budgets typically allocated to mental health as per the WHO. There were overwhelmed systems, which first responders and healthcare workers often lack psychological first aid, which means PFA training, as seen in overwhelmed systems post 2017 Hurricane Maria. High demand on post-disaster strains, limited mental health resources. They were addressing long-term needs, which means recovery takes years, but funding for mental health support often drops within months. For example, post-2004 tsunami long-term counseling programs dwindled by 2006. Chronic conditions like PTSD require sustained intervention, yet resources are scarce. Now there are some strategies for mental health support. At first we look at the preparedness activities where community educations are given, workshops on stress management, coping strategies, building resilience. Example, India's pre-monsoon mental health programs in flood-prone areas were conducted, where it equipped first responders like police or firefighters to provide immediate emotional support, focusing on safety, stabilization, and resource connection. Whereas in communities which foster social networks via community centers to reduce the isolation on pre-disaster. Let's look at the response strategies, which is after the immediate PFA. Safe spaces for survivors to express emotions using active listening, validation, and calming techniques are important. One of the examples is Red Cross PFA post-2023 Turkey Syria quick. There are some child-friendly spaces where shelters, play, and art areas reduce trauma. This has been seen in UNICEF Spaces post 2019 Cyclone Idai in Mozambique. There are some mobile mental health units which counselors deployed to disaster sites, example Haiti post 2010 earthquake. There are crisis hotlines, which is 24/7 multilingual support, like the US distress helpline. Now let's look at the recovery support initiatives. There are some long-term counseling, which group therapy or community health centers addresses PTSD and anxiety. The school-based interventions where teachers trained to identify trauma through art therapy or the programs. There are community rebuilding, which projects like gardening restore purpose. This addressing stigma, public campaigns normalize mental health care, partner with local leaders for culturally sensitive messaging. For example, religious leaders in India promoting therapy post-2024 floods. Now let's look at for some of the case studies that I'm going to show off. The first case study is 2004 Indian Ocean tsunami in South Asia that had a widespread trauma with 30% of children showing PTSD symptoms. This data was taken from the UNICEF. Next is a response where NGOs like Save the Children used art therapy to help children express their grief, reducing long-term psychological issues. From this lesson was learned early intervention prevents chronic trauma. Next look at 2017 Hurricane Maria. This impacted infrastructure collapse, limited mental health access, with 20% of survivors reporting depression. It was reported through FEMA. Response was telecounseling and community support groups, bridge gaps, where lesson was learned that technology is critical is a resource scarce settings. Next is 2023 Turkey Syria earthquake. The impact of the refugees faced heightened trauma due to displacement. These reports were found out from the WHO. The response was Red Cross's mobile mental health teams offered multilingual PFA addressing language barriers. Lesson was learned, culturally sensitive and accessible support is essential for diverse groups. What is the role of technology in support, right? This means teletherapy and apps, where platforms like Better Health and apps like Headspace provide remote counseling and mindfulness. For example, post-2020 Australia bushfire app downloads surged 50%. Next, look at the X platform. It's another app, which means their real-time sharing of helplines and coping tips. This was seen in 2024 Hurricane Post shared US distress helpline, which was used in a peer support groups, reduce the isolations via hashtags like hashtag mental health managers. There are some AI and data analytics, which means AI chatbots, example robot, offer instant emotional support. Data analysis identifies at-risk individuals. For example, 2024 California wildfire trials were done. Virtual reality, which means VR. VR therapy recreates safe environments for PTSD recovery. There is some visual aid chart that is to illustrate. Next, we will look at the recommendations for policymakers, which is to integrate mental health, which allocate at least 10% of disaster budget to mental health services, including mobile units and teletherapy infrastructure. There were trained workforce, partner with universities to train community health workers in PFA, aim for one trained responder per 1,000 residents in disaster-prone areas. This promotes accessibility to ensure services in multiple languages, example Hindi, Tamil in India, and formats, example sign language. There is leverage technology, invest in teletherapy platforms and X-based campaigns for real-time resource sharing. There is a reducing in stigma where launches campaigns like India's Manasik Swasthya to normalize mental health care involving local leaders for cultural relevance. That's all for today. Thank you.
If anyone has any questions, please feel free to ask now. We welcome your inquiries on the psychological effects of disasters, mental health support, strategies, or their broader implications for recovery and community resilience.
Yes.
What are some local or cultural barriers to mental health support in your community?
Where in many communities, stigma has been around mental health, like viewed therapy as a weakness in Asian cultures, so that there are limited access to the professionals in rural areas that need the support. Yes,
You told about apps like teletherapy and X. So my question is, how can this technology improve mental health outcomes on post-disaster?
Well, the teletherapy and X provide accessible counseling and resource sharing, which reduce stigma and connecting survivors to the supporters. This has been seen in 2024 hurricane responses, and this also has a hotline which allows the survivors to connect to them and have an immediate, easy access to the resources. Thank you.
Thank you, Nandana, for that compelling presentation on psychological impact of disasters and mental health support. Your insights illuminated a critical aspect of disaster recovery, deepening our understanding of how mental health support fosters resilience in affected communities. With the point to point of, we continue to explore vital topics shaping human and societal well-being. Wishing everyone a great evening and see you at the next session.